the incessant burning sensation in your feet, the unsettling numbness and persistent tingling that frequently interrupts your precious sleep, the sudden, sharp, shooting pains that unexpectedly course through your hands and legs, the profound and disconcerting feeling that your balance has become utterly unreliable, coupled with a noticeable and disheartening decline in your physical strength. These are all profoundly debilitating symptoms that significantly impact daily life, eroding comfort and independence. If any of these deeply challenging experiences resonate with you, it is crucial that you absorb a vital piece of information, a fundamental truth that, regrettably, the vast majority of individuals who receive a diagnosis related to these symptoms are almost never made aware of. Neuropathy, in its essence, is not an immutable disease in itself. Rather, it functions as a critical physiological alarm system. It represents your intricate nervous system unequivocally communicating to you that an underlying issue or combination of issues is actively causing damage to your delicate nerve tissues. Consequently, the single most pivotal inquiry you can pose, and indeed the one that holds the key to genuine improvement, is not about which pharmaceutical intervention might merely suppress or quiet this insistent alarm, but rather what fundamental biological trigger or combination of factors initiated this damage in the very first place. As Dr. Emily Carter, I can attest from extensive clinical practice that a significant proportion of patients presenting with symptoms of peripheral neuropathy have previously been given an idiopathic diagnosis. This medical term, idiopathic, serves as a formal declaration that, from a conventional standpoint, the underlying cause remains entirely unknown. Typically, when this label is assigned, the investigative process abruptly ceases, and the subsequent discussion within the medical consultation invariably shifts towards prescribing medications such as gabapentin or exploring various other strategies primarily focused on symptomatic pain management, rather than diligently pursuing and addressing the root cause of the nerve damage itself. This conventional approach, while offering temporary relief, often overlooks the body's profound innate capacity for healing if properly supported and if the true origins of the distress are meticulously uncovered. It is paramount to understand that your nerves are not static entities. They are dynamic, living tissues, requiring a precise and constant supply of specific nutrients, adequate and unimpeded blood flow to deliver these vital components, and an internal environment rigorously free from the myriad of things that can actively damage them. My mission today is to meticulously guide you through the major, yet often overlooked, causes of peripheral neuropathy, with a particular and emphatic focus on nutritional deficiencies. This emphasis stems directly from my extensive clinical experience, which consistently reveals that nutritional status is almost always an integral part of the larger clinical picture, even when it may not be the solitary explanation for the condition. Beyond merely identifying these causes, I will also provide you with a pragmatic and effective testing approach, along with actionable solutions designed to genuinely address the underlying biological processes that are contributing to your nerve dysfunction and pain. To fully grasp the significance of these solutions, let us first briefly delve into the fundamental mechanics of what transpires when nerves are subjected to damage, as understanding this intricate mechanism illuminates the rationale behind every subsequent piece of information presented. Each individual nerve fiber within your elaborate peripheral nervous system is enveloped in a crucial protective fatty coating known as myelin. This myelin sheath can be conceptually likened to the insulating layer around an electrical wire. It is this insulation that facilitates the rapid, efficient, and accurate transmission of electrical signals between your brain and the entirety of your body. When these vital nerve cells endure damage, the myelin sheath begins to progressively deteriorate. This degradation inevitably leads to a significant slowdown in signal transmission, causing signals to misfire erratically, or, in more severe instances, to break down entirely. This critical impairment in nerve communication is precisely what generates the hallmark symptoms of peripheral neuropathy, The inexplicable tingling, the persistent numbness, the burning sensations, the debilitating weakness, and the troubling balance problems that collectively define the condition. In cases where the damage is more advanced and prolonged, the delicate nerve fiber itself can begin to physically break down, exacerbating the patient's suffering and functional decline. At this juncture, I feel compelled to share a crucial insight that directly counters a long-held yet outdated belief about nerve damage. You may have been informed, perhaps by medical professionals, that nerve damage is an irreversible, permanent condition. However, this is old thinking, a perspective that modern scientific understanding has comprehensively debunked. Burgeoning and exciting field of neuroplasticity has unequivocally established that nerves possess a remarkable capacity for healing and regeneration. While it is true that nerves tend to heal more slowly than many other bodily tissues, often requiring considerable patience, with full recovery potentially spanning a year or even more, the fundamental truth remains: healing is profoundly possible. The cornerstone of this healing process lies in two critical actions. First, the meticulous identification and subsequent elimination of whatever is actively causing the ongoing damage to the nerves. And second, the diligent provision of the precise nutritional building blocks that the nerve tissues require to reconstruct and repair themselves. This dual strategy forms the bedrock of what we will explore in depth today. Peripheral neuropathy, as a complex syndrome, can originate from a multitude of potential causes, and in my extensive clinical practice, it is almost invariably the result of not just one isolated factor, but rather a confluence of multiple, often synergistic issues. The most significant and frequently observed categories of triggers encompass a spectrum of conditions, including various blood sugar dysregulation problems, profound nutritional deficiencies, exposure to a range of toxic substances, which alarmingly includes many commonly prescribed medications and alcohol, autoimmune conditions where the body mistakenly attacks its own nerve tissue, insidious infections, digestive diseases that compromise nutrient absorption, environmental exposures such as mold and mycotoxins, physical mechanical compression or trauma to nerve pathways, and finally, the catch-all category that doctors label idiopathic. This term, idiopathic, in essence, typically signifies an intricate web of multiple, overlapping triggers that, unfortunately, no one has yet invested the necessary time and investigative effort to meticulously untangle and identify. While all these potential causes warrant attention, I intend to dedicate the most significant portion of our discussion today to the interplay of blood sugar regulation and nutritional status. These two areas are particularly empowering because they represent domains where individuals possess the most direct capacity to take proactive action, and crucially, where we consistently observe the most profound and meaningful clinical improvements in patients' conditions. However, it is also imperative that I briefly address the often overlooked impact of medications, as many of the pharmaceutical agents most commonly prescribed to seniors, particularly those over the age of 60, quietly and insidiously deplete the exact nutrients that are absolutely essential for the healthy functioning and integrity of the nervous system. This critical interaction, regrettably, is almost never thoroughly discussed or disclosed during the appointment when the prescription is originally written, leaving many patients unknowingly vulnerable to further nerve damage. Blood sugar problems stand as one of the most prevalent yet consistently underestimated underlying causes of peripheral neuropathy. While most individuals possess a general awareness that full-blown diabetes can lead to severe nerve damage, what remains largely unknown to far fewer people is the critical fact that nerve damage attributable to chronically elevated blood sugar can commence and progress insidiously for years before a formal diabetes diagnosis is ever made. This damage frequently begins within the pre-diabetic range, a period where fasting blood glucose levels may still deceptively appear normal, yet the insidious condition of insulin resistance is already firmly established and actively at play. When blood sugar levels are chronically elevated, a detrimental process known as glycation is initiated. This process involves sugar molecules permanently bonding to proteins throughout the entire body, a phenomenon that regrettably includes the crucial proteins that constitute nerve tissue. This sugaring of nerve proteins directly interferes with their normal function and structural integrity. Furthermore, elevated blood sugar levels also trigger the generation of excessive free radicals, highly reactive molecules that inflict oxidative damage upon the delicate mitochondria residing within nerve cells, impairing their energy production capabilities. It also disrupts the specialized cells responsible for producing myelin, the protective sheath around nerves, and significantly reduces the availability of nerve growth factor, a vital chemical signal indispensable for instructing nerves to repair and regenerate themselves. Alarmingly, every single one of these destructive mechanisms is being activated simultaneously and synergistically when blood sugar levels remain consistently above optimal parameters for extended durations, creating a cascade of damage that steadily erodes nerve health. Here is a piece of information I want every single person watching this to internalize. If your A1C, a measure of average blood sugar over 2 to 3 months, falls anywhere between 5.7 and 6.4, which is the established pre-diabetic range, nerve damage may already be actively occurring, even if you are entirely asymptomatic or unaware. A standard fasting blood glucose test, while seemingly reassuring, can indeed appear normal, thereby masking the underlying presence of insulin resistance that is already silently yet significantly damaging peripheral nerve tissue. For a more accurate and comprehensive assessment of your blood sugar regulation status, the more precise and telling tests to request are fasting insulin, which ideally should be below 5 units, and a full A1C measurement. If you are experiencing unexplained neuropathy symptoms and have never had these specific markers thoroughly evaluated, I implore you to proactively ask your doctor to order both. This crucial step could unveil a root cause that has been persistently overlooked. And here lies the medication aspect of this complex issue that causes me the most profound concern. Metformin, the most widely prescribed oral medication globally for the management of type 2 diabetes, has a well-documented and recognized side effect. It actively depletes vital nutrients such as vitamin B12, folate, and CoQ10 from the body. The critical issue here is that all three of these specific nutrient deficiencies are independently known to cause peripheral neuropathy. Consequently, in a substantial number of cases, individuals are initially developing neuropathy due to their elevated blood sugar levels. They are then prescribed metformin to manage their diabetes, a medication that, unbeknownst to them, further depletes the very nutrients their nervous system desperately requires for protection and repair. This unfortunate sequence leads to a worsening of their neuropathy symptoms, while everyone involved, including the patient and their healthcare providers, mistakenly attributes this deterioration solely to the natural progression of their diabetes. The tragic irony is that the medication intended to help is, in some ways, exacerbating the problem. However, there is a powerful message of hope embedded within this challenge. When a well-structured and disciplined dietary regimen successfully brings blood sugar levels under optimal control, often eliminating the need for metformin altogether, the subsequent nerve recovery can frequently be nothing short of remarkable. It is crucial to remember that type 2 diabetes is, in many instances, a reversible condition through dedicated dietary and lifestyle modifications. And when type 2 diabetes reverses, so too does a significant portion of the widespread damage it has inflicted, including the often debilitating effects on the peripheral nerves. This underscores the profound potential for healing through informed intervention. Indeed, nutrition emerges as the undeniable central theme, an overarching narrative that intertwines through almost every conceivable cause of peripheral neuropathy. And I emphasize very specifically because its influence is far-reaching and multifaceted. Consider, for instance, environmental toxins. While they directly contribute to neuropathy, They also simultaneously induce or exacerbate profound nutritional deficiencies within the body, creating a double burden on nerve health. Similarly, gluten, for many sensitive individuals, can directly cause neuropathy, but it achieves this partly by inflicting damage upon the delicate lining of the gut, thereby compromising and blocking the crucial absorption of essential nutrients. Surgical procedures on the digestive tract, particularly those involving resections or significant alterations, frequently lead to neuropathy because they fundamentally impair the body's intricate ability to adequately absorb and utilize vital vitamins and minerals from consumed food. Even nerve damage resulting from physical trauma, such as an injury or accident, will heal far more slowly, or tragically, may fail to heal entirely when the body is critically deprived of the precise nutritional building blocks indispensable for efficient repair and regeneration. A landmark review published in the esteemed Journal of Neurology, Neurosurgery, and Psychiatry articulated this connection with unequivocal clarity, stating that peripheral neuropathy occurs most frequently secondary to B vitamin deficiencies. This is not merely an association, but a direct causal relationship. Deficiencies in individual B vitamins, specifically B1, B2, B6, B9, folate, and B12, have all been conclusively shown to precipitate peripheral neuropathy when their levels within the body fall below critical thresholds. The scientific evidence supporting this direct causal link is robust and exceptionally well established. And yet, in my personal clinical experience, the overwhelming majority of individuals who present to me with a formal neuropathy diagnosis have astonishingly never undergone a truly comprehensive nutritional assessment. A standard serum B12 test, for instance, which is frequently ordered, can often appear normal even in individuals suffering from significant cellular deficiency. This misleading result occurs because the body prioritizes maintaining circulating blood levels of B12 by relentlessly drawing upon its tissue stores, even when those reserves are critically depleted at the cellular level where nerve function truly happens. Such a serum test is merely a single, limited data point, incapable of painting the full and accurate picture of an individual's actual nutritional status. If this information is illuminating previously unconnected dots in your understanding of your health challenges, I encourage you to take a moment to engage with this content by liking this video and subscribing to my channel. I am dedicated to sharing honest, evidence-based, and practical health guidance specifically tailored for people over 60 every single week, aiming to empower you with knowledge that can truly transform your well-being. We still have crucial insights to cover, including specific key nutritional deficiencies, a comprehensive list of medications that can contribute to neuropathy, and the most effective testing and treatment approaches. Let us now systematically explore the individual nutrients that play the most direct and indispensable roles in maintaining optimal peripheral nerve health. Understanding the specific physiological function of each one makes a compelling case for precisely why a deficiency in any of them can lead to profound and tangible nerve damage. Vitamin B1, commonly known as thiamine, is absolutely essential for the critical energy production pathway that operates within every single nerve cell. Without an adequate supply of thiamine, nerve cells simply cannot efficiently convert the nutrition they receive into adenosine triphosphate, ATP, the fundamental energy currency that powers every cellular process, including the vital maintenance of the myelin sheath and the intricate process of nerve repair. B1 deficiency specifically manifests as lower limb weakness and the characteristic burning sensations often experienced in the feet. And this deficiency is far more prevalent than most medical practitioners currently recognize, particularly in individuals consuming diets excessively high in refined carbohydrates, which rapidly deplete the body's precious B1 stores. The form of B1 that consistently demonstrates superior efficacy for nerve health is benfotiamine, a unique fat-soluble derivative that is capable of reaching nerve tissue much more effectively and in higher concentrations than standard water-soluble thiamine. Vitamin B5, or pantothenic acid, deserves particular and focused attention due to its strong association with one highly specific and distressing symptom of neuropathy. If your feet experience an intense, unrelenting burning sensation predominantly at night, a discomfort so severe that it routinely wakes you from sleep or actively prevents you from falling asleep in the first place, then a vitamin B5 deficiency stands as the most frequent and often overlooked cause of this very distinct symptomatic pattern. B5 is an indispensable cofactor required for the cellular production of coenzyme A, CoA, a pivotal molecule that is absolutely essential for healthy nerve lipid metabolism and for the proper formation and maintenance of the myelin sheath that insulates nerve fibers. Therefore, if burning feet are your primary and most troubling symptom, investigating your B5 status should be among your very first diagnostic considerations. Vitamin B6 is intricately involved in several critical neurological processes, notably sphingolipid synthesis, which is the complex biochemical pathway by which the body produces new myelin, directly impacting nerve insulation and signal speed. Furthermore, B6 is a crucial cofactor in the synthesis of GABA, gamma-aminobutyric acid, the primary inhibitory neurotransmitter in the central nervous system, responsible for calming excessive nerve activity and promoting relaxation. When considering supplementation, a vital distinction in forms matters significantly. Vitamin B6 is commercially available in two primary forms: pyridoxine hydrochloride, which is the inactive precursor form, requiring liver conversion to become biologically active, or pyridoxal 5-phosphate, P5P, which is the active coenzyme form that your body can directly utilize without further metabolic processing. It is critically important to note that high doses of pyridoxine hydrochloride can, paradoxically, worsen neuropathy symptoms, because the liver's capacity to convert this inactive form to P5P can become inefficient or saturated at elevated doses, potentially leading to an accumulation of unmetabolized pyridoxine that can be neurotoxic. If you are currently taking B6 in the form of pyridoxine and your neuropathy symptoms have not improved or have even deteriorated, switching to P5P and maintaining a conservative daily dose, typically around 50 milligrams, is generally considered a safer and demonstrably more effective therapeutic approach. Vitamin B12 is the nutrient I consider unequivocally most critical for the intricate process of nerve repair and regeneration. Alarmingly, deficiency of this vital nutrient after the age of 60 is exceptionally common. This widespread deficiency is often not due to insufficient dietary intake of B12-containing foods, but rather to a physiological change that occurs with aging. The stomach progressively produces less intrinsic factor. Intrinsic factor is a specialized protein absolutely essential for the proper absorption of dietary B12 from the digestive tract into the bloodstream. Furthermore, a standard serum B12 blood test will frequently yield a normal result, even when cellular B12 levels are significantly depleted. This misleading phenomenon occurs because the body meticulously strives to maintain circulating blood levels of B12 by drawing upon its dwindling tissue stores, masking a critical deficiency at the cellular level where it truly impacts nerve function. The more accurate and functionally relevant tests to assess true B12 status are methylmalonic acid, MMA, and homocysteine levels, both of which reflect whether B12 is actually active and effectively utilized at the cellular metabolic level. When considering B12 supplementation for nerve repair, it is crucial to use methylcobalamin, which is the naturally active form, rather than cyanocobalamin, a synthetic form that requires conversion in the body. Ideally, methylcobalamin should be administered as a sublingual lozenge that dissolves under the tongue, bypassing the compromised absorption pathways in the gut altogether and allowing for direct entry into the bloodstream. Therapeutic doses specifically for nerve repair typically start at 1 to 2 milligrams daily. Magnesium plays a profoundly important role as the natural gatekeeper of NMDA receptors, which are specific nerve receptors that, when excessively stimulated, can cause nerve cells to fire uncontrollably, leading to excitotoxicity and even nerve cell death. Adequate levels of magnesium naturally serve to block the excessive influx of calcium into nerve cells, an event that would otherwise trigger this destructive overstimulation. Beyond its neuroprotective role, magnesium is also a potent natural muscle relaxant, effectively alleviating muscle spasms and the resulting mechanical compression that can secondarily damage delicate peripheral nerves. Shockingly, nearly 68% of adults over the age of 60 are estimated to be deficient in this vital mineral. Among the various forms of magnesium available, magnesium glycinate is widely considered the best absorbed and gentlest form for most individuals, minimizing digestive upset. The dosage range extensively studied for nerve-related conditions typically spans from 300 to 800 milligrams daily, with the recommendation to always commence supplementation at the lower end of this range and gradually increase as tolerated. Vitamin E is a powerful fat-soluble antioxidant that provides crucial protection for the delicate fatty membranes surrounding nerve fibers from the ravages of oxidative damage, which can otherwise compromise their integrity and function. Deficiency in vitamin E can lead to a progressive sensory nerve condition that often shows noticeable and significant improvement with consistent supplementation. If you have undergone gallbladder removal or suffer from any medical condition that impairs fat absorption, such as certain digestive disorders, vitamin E deficiency represents a direct and elevated risk, precisely because it is a fat-soluble vitamin requiring dietary fat for proper assimilation. The alpha-tocopherol form of vitamin E, typically dosed at 400 to 600 milligrams daily, is the concentration most thoroughly studied and shown to be effective for nerve protection, even serving as a preventive measure during certain chemotherapy regimens known to induce neuropathy. Omega-3 fatty acids, specifically eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, are integral structural components that are incorporated directly into nerve cell membranes. Crucially, they also play a significant role in modulating and reducing the inflammatory response that inevitably follows nerve damage, thereby facilitating a more conducive environment for healing. The dietary ratio of omega-6 to omega-3 fatty acids profoundly influences the intensity and duration of the inflammatory aftermath of any nerve injury. The pervasive modern Western diet, unfortunately characterized by its high content of seed oils, processed grains, typically creates an alarmingly imbalanced omega-6 to omega-3 ratio, often as high as approximately 16 to 1 in most individuals I clinically assess. An optimal ratio, which supports overall health and mitigates inflammation, is considerably lower, ideally closer to 2 to 1 or 3 to 1. Clinical studies utilizing high doses, ranging from 2,400 to 7,200 milligrams of combined EPA and DHA daily, have consistently demonstrated meaningful and clinically significant reductions in neuropathic pain. Therefore, for individuals consuming a diet rich in vegetable oils and processed foods, actively correcting this critical omega-6 to omega-3 ratio through dietary modification and targeted supplementation may represent one of the single most impactful changes they can implement to alleviate nerve pain and promote nerve health. Coenzyme Q10, CoQ10, is an absolutely vital nutrient, indispensable for efficient mitochondrial energy production within nerve cells. Mitochondria, often referred to as the powerhouses of the cell, are particularly abundant and active in nerve cells due to their high energy demands. Alarmingly, CoQ10 is directly and significantly depleted by statin medications, a class of drugs that are among the most widely prescribed globally, especially for individuals over the age of 60 to manage cholesterol levels. Consequently, when I encounter a patient presenting with neuropathy who has been on statins for many years, addressing and correcting a potential CoQ10 deficiency immediately becomes one of my primary therapeutic priorities. Another potent and extensively studied compound for nerve health is alpha-lipoic acid, ALA. Dosed at 600 milligrams daily, ALA has shown strong evidence for effectively reducing the debilitating symptoms of diabetic neuropathy, including tingling, burning sensations, and numbness. Its remarkable efficacy stems from its function as a potent antioxidant, uniquely capable of operating both in fat and water-soluble environments, and specifically targeting oxidative stress within the mitochondria, thereby protecting nerve cells from further damage and supporting their reparative processes. It is imperative that I dedicate a specific discussion to the role of medications, as this represents a critical area where many seniors are unknowingly experiencing harm and a deterioration of their nerve health. A staggering number, over 500 commonly prescribed medications, last peripheral neuropathy or direct nerve damage as a documented and recognized side effect in their pharmacological profiles. For older adults, who frequently manage complex health profiles and are often simultaneously taking 5 or more medications, the cumulative impact of these drugs on the delicate health of their nervous system can be profoundly significant and devastating. Beyond metformin, which we have already discussed in detail for its B12, folate, and CoQ10 depleting effects, other widely used medications pose substantial risks. Proton pump inhibitors, PPIs, taken by millions of seniors to manage acid reflux and heartburn, are known to deplete both B12 and magnesium, two nutrients directly and critically involved in optimal nerve function. Statin medications, as previously mentioned, directly interfere with the body's natural production of CoQ10. Certain classes of antibiotics, particularly fluoroquinolones, are infamous for causing direct mitochondrial damage within cells, which can in turn precipitate acute and sometimes irreversible neuropathy. Anti-seizure medications commonly deplete various B vitamins, while corticosteroids, frequently prescribed for inflammation, can deplete magnesium, potassium, B1, and zinc. Even newer weight loss drugs, such as GLP-1 agonists, carry an inherent risk of accelerating nutritional deficiencies that can, in turn, trigger or worsen neuropathy. Furthermore, alcohol, which acts as a direct neurotoxin, simultaneously depletes virtually every nutrient essential for robust nerve health. I must emphasize unequivocally, I am absolutely not suggesting that you unilaterally stop any medication that has been prescribed to you by your doctor. What I am strongly advocating is that if you are experiencing symptoms of neuropathy and are currently taking any of the medications I have mentioned, requesting a formal and comprehensive medication review from your prescribing physician is not only a completely legitimate and important request, but an essential step in your health journey. Ask your doctor specifically whether any of your current medications are known to deplete nutrients vital for nerve health, and crucially, whether ongoing nutritional monitoring should be integrated as a regular component of your continuous care. This single, informed conversation has the potential to dramatically alter the trajectory of many people's health and lead to significant improvements in their neuropathy symptoms. The most fundamental and empowering principle I can impart to you regarding the investigation of your own neuropathy is this: test, do not guess. Relying on assumptions when it comes to nerve health is a perilous path. Here is a comprehensive list of specific tests and assessments you should proactively request from your healthcare provider. The most comprehensive and revealing nutritional assessment available is an intracellular nutrient analysis. This advanced test measures the actual vitamin and mineral content inside your cells rather than merely in your circulating blood plasma. This provides a far more accurate and clinically relevant picture of the precise nutrient resources your nerves actually have available to them for function, maintenance, and repair. This is distinctly different from the standard serum blood tests most doctors typically order, which, as previously discussed, frequently miss critical deficiencies because blood levels are often artificially maintained by the body drawing relentlessly from its tissue stores, even when those stores are critically depleted and cellular function is compromised. Beyond that, to meticulously assess your blood sugar regulation, ask for fasting insulin, not just fasting glucose, as this will help detect insulin resistance long before it fully manifests as type 2 diabetes. Request an A1C measurement for a longer-term view of blood sugar control. To functionally evaluate your B12 and folate status, ask for methylmalonic acid, MMA, and homocysteine levels, as these are far more indicative of cellular utilization than serum levels alone. If you also experience persistent, dry, gritty eyes alongside your neuropathy symptoms, specifically inquire about Sjogren's syndrome, an autoimmune condition, and request the anti-SSA and anti-SSB antibody tests. If your neuropathy includes a troublesome loss of balance and you regularly consume gluten, discussing HLA-DQ genetic testing for gluten sensitivity is highly advisable. It is vital to recognize that non-celiac gluten sensitivity can precipitate significant neurological damage even in the complete absence of any digestive symptoms. If you have a history of significant or prolonged mold exposure in your home or workplace, mycotoxin testing is a worthwhile and important diagnostic consideration. Finally, a specialized skin biopsy can definitively confirm the presence of small fiber neuropathy, especially in cases where standard nerve conduction studies, NCS, appear normal. NCS frequently yield normal results in early or isolated small fiber neuropathy, which is precisely why so many individuals are mistakenly told nothing is wrong by their doctors, despite experiencing clearly present and debilitating symptoms. I want to be absolutely candid and transparent with you about the realistic healing timeline, as this is precisely where many individuals, through no fault of their own, prematurely lose hope, often unnecessarily. Nerve healing is inherently a slow, methodical process. Axons, the long projections of nerve cells, do not regenerate or repair overnight. Based on clinical observation, most people typically begin to notice meaningful and tangible improvements in their symptoms between 3 and 6 months of consistent and diligently applied nutritional correction and root cause addressing. Furthermore, structural improvements in nerve conduction velocity, which can be objectively measured, generally become demonstrably evident between 6 and 12 months of sustained intervention. Committing to a course of treatment for such an extended period without immediately visible results in the early weeks can be emotionally challenging, and this is exactly why objective testing and meticulous monitoring matter so immensely. When you can witness your methylmalonic acid levels normalizing or observe your intracellular B12 levels transitioning from a deficient state to an optimal range, you gain concrete, verifiable evidence that fundamental biological changes are indeed occurring beneath the surface, even before the burning sensation in your feet has completely resolved. Therefore, I urge you to diligently track the objective numbers from your tests, meticulously track your subjective symptoms, and crucially, celebrate every incremental progress you make along this healing journey. Allow me to share a patient experience that remains profoundly impactful and deeply etched in my memory. Patricia arrived at my clinic having been largely confined to a wheelchair due to progressive neuropathy that had devastatingly begun in her feet and steadily advanced upwards over an 18-month period. She had navigated through consultations with multiple specialists, enduring the frustration of being told that the cause of her condition was unknown and that her prognosis was guarded. Upon a thorough and comprehensive investigation into her nutritional status, we uncovered severe deficiencies in vital nutrients, specifically vitamin D, vitamin B12, and vitamin B1, alongside a significant and previously unidentified gluten sensitivity. Tragically, in her previous medical encounters, No one had bothered to ask the fundamental question of why her nerves were failing. The focus had been solely on attempting to manage her debilitating symptoms. Our approach was fundamentally different. We meticulously corrected her specific nutritional deficiencies and completely eliminated gluten from her diet. Within a mere 3 months, her most severe and disabling symptoms had begun to stabilize, providing the first glimmer of hope she had experienced in years. Within a year, Patricia had made a remarkable recovery, regaining her independence and returning to living life on her own terms. Her nerves had not been permanently destroyed. Rather, they had been starved of essential nutrients and subjected to a relentless attack from unaddressed underlying issues. When we ceased the attack and diligently provided the necessary nutritional building blocks, her nerves demonstrated their inherent capacity to heal and regenerate. That powerful and hopeful message is precisely what I want you to carry with you from today's discussion. Peripheral neuropathy, in the vast majority of cases, is not an immutable sentence of perpetual suffering. Rather, it is a critical signal from your body, an urgent communication that something is profoundly amiss and requires immediate, intelligent attention. Your path to recovery begins by finding a healthcare professional who is not merely willing, but eager to ask the crucial question of why, and who is committed to meticulously testing for the underlying answers, rather than simply medicating the manifest symptoms. You unequivocally deserve that thorough investigation into your health. Your delicate nerves deserve that profound investment of time, effort, and informed care. I invite you to share your experiences by dropping a comment below. Tell me, how long have you been dealing with neuropathy symptoms, and has anyone ever taken the crucial step of testing your nutritional status as an integral part of your care? I personally read every single comment on this channel, valuing your insights and experiences. If this video has provided you with a new, empowering direction to explore in your health journey, please consider sharing it with someone you know who is struggling with unexplained nerve symptoms. Remember to subscribe for more research-based guidance and actionable health tips every single week. I am Dr. Emily Carter, and I look forward to seeing you in the next video.